Precordial examination, just auscultate the heart sound, obviously keeping a finger over carotid pulse. So percussion over apex of the lungs, percussion over clavicle, both on the front and obviously on the side. You have to use these three fingers, two over sternoclavicular joints and one to feel the trachea. We have our subject with us, but we do not have a patient with lump, and usually in the examination you might have a mannequin or dummy with a lump, or if a patient with benign lump with non-irritable sign symptoms such as lipoma or sebaceous cyst, those might be given as subjects. So today our first station will be about CRISP protocol. We all know from applied surgical science and critical care stations that what is CRISP. CRISP means care of the critically ill surgical patient. Before going to examination, just I will discuss about few important points, because in the examinations you might have two types of patients presenting with CRISP, or those might be needed to examine under this protocol. One will be a patient with suspected postoperative anastomotic leakage, and another will be suspected postoperative pulmonary embolism. The most important issue is to identify whether it is usual abdominal examination or is it due to anastomotic leakage, and you have to shift to the CRISP protocol. Because from my personal experience, my examination occurred on January 2024 and I had a patient with this station. But let me share where the problem occurs or confusion occurs. I was giving or I was about to enter to another station just opposite to this station, that was a CRISP. Okay, so before entering into my station, I heard that the examinee there was telling on percussion, I felt such as such, on auscultation I felt such as such. So I assumed that might be an abdominal examination. But whenever I entered that particular examination station, I said that no, this was a CRISP station. Okay, and the examiner was very much expressionless. Okay, so there are some guidelines or there are some indicators which will guide you that you have to shift to the CRISP protocol there. Okay, so let me discuss some points about that. So at the station where you have to follow this CRISP protocol, that is care of the critically ill surgical protocol, patient's protocol, there will be post-operative patient, mind it, there will be post-operative patient. So on a abdominal examination, on inspection, you will find a bandage there, either on the abdomen or on the pelvic region or limb. If this patient has to be anastomotic leakage, usually there will be a midline incision, either upper midline or lower midline or mid-midline incision, because commonly we know anastomotic leakage occurs in case of left colon surgery, such as colorectal cancer surgery. Whereas pulmonary embolism occurs following major abdominal surgery or pelvic surgery or hip replacement surgery due to prolonged immobilization. Anastomotic leakage, as it shows or manifests with the features of infection, that might occur on the postoperative day, 5th or 6th postoperative day. Okay. Whereas pulmonary embolism needs a bit longer to develop the thrombus. So it might be on 8th, 9th or 10th or 11th postoperative day. Okay. Anastomotic leak might present with the patient having abdominal pain, shortness of breath and left shoulder tip pain. Why is it? Because the contents or free intra-abdominal collection might be irritating the diaphragm, causing pain on the left shoulder tip. Whereas patients with pulmonary embolism will present with only chest pain. There will be no problem in his abdomen or tummy. In case of anastomotic leak, the patient will be wearing thromboembolic deterrent devices such as compression stockings or anything else, because it will prevent development of pulmonary embolism or deep vein thrombosis. Whereas in case of pulmonary embolism patient, there will be no TED, that is thromboembolic deterrent device or deterrent stockings. This is a very important indicator. In both the cases, you have to examine the lower leg or lower limbs or calves for signs of any deep vein thrombosis or presence or absence of thromboembolic deterrent devices. Usually, this patient gives history of missing one or more dose of low molecular weight heparin following surgery. In case of anastomotic leak, we will not examine the chest from back, because in case of chest pain or shortness of breath in case of abdominal pain, we do not proceed to examine chest from back, because this might cause discomfort to the patient. But in case of pulmonary embolism, we will have to examine the chest from front, side and back. Okay. Now the final one, the lower midline incision and light abdominal palpation. Okay. If the patient is about to have anastomotic leakage, you have to proceed initially according to normal abdominal examination. Okay, and you have to assure the patient about as if you are going to inspect the abdomen, palpate the abdomen, then percuss and auscultate the abdomen. But what is the point of shifting towards crisp from abdominal examination? That is during superficial palpation. You will perform the inspection as usual. Your inspection will be as usual, but when you will tell the patient that I am now going to feel over your tummy, during this superficial palpation, the patient will scream highly, or he will show that he has agonizing pain or tenderness. So in that case, just you tell your examiner, sir, this patient is critically ill, so I cannot proceed or further proceed to abdominal examination. Now I want to examine this patient under care of critically ill surgical patient protocol. So you have to mention the full form, not the crisp protocol, that I want to now examine the patient according to care of the critically ill surgical patient. So the landmark between abdominal examination and shifting towards the crisp is superficial palpation. Okay, so you cannot proceed further after superficial palpation. But in case of pulmonary embolism, you will have to examine the patient under crisp protocol from the beginning, because this patient will be showing that he is in severe respiratory distress or chest pain. Okay, he will hold his chest and you will see a scar mark there. So